So if there is retention of urine in an older person, and the older, the more older he is, the more the chances are it is due to prostate. That is one. Second cause, generally in younger patients, is stricture urethra, which means the urethra is the tube that comes from the prostate and comes into the penis and out. Okay? If there is any narrowing anywhere inside this tube, then patient can have retention of urine or inability to pass urine because the narrowing over there.
सर्जरी सिंप्लीफाइड, शस्त्र कला सरल शब्दों में।
हेलो एवरीवन, वेलकम बैक टू आवर चैनल सर्जरी सिंप्लीफाइड, शस्त्र कला सरल शब्दों में। मेरे साथ है डॉक्टर निखिल।
नमस्ते।
डॉक्टर, आज कौन से नए टॉपिक पे डिस्कस करने वाले हैं?
बेसिकली अभी हमने जनरल सर्जरी जो बोलते हैं
जी,
वो टॉपिक्स हमने खत्म कर दिए। ओके, ऑफ कोर्स देयर आर मेनी टॉपिक्स बट वी कैन नॉट टेक ईच टॉपिक। आई एम गोइंग बाय व्हाट इज most commonly seen in a particular area. For example, we discussed thyroid. This is the commonest swelling in the neck.
Correct.
So now we will go on to urology.
Okay.
So urology mein I am going to discuss again symptom wise. So the first episode will be on inability to pass urine. That means person has urine is filled but is not able to pass urine. What are the conditions? And then each condition we will discuss.
Sure.
There are 3 or 4 conditions which we will discuss in subsequent episodes. The second symptom will be blood in the urine. Okay. Second symptom will be blood in the urine. Again, there will be 1 or 2 conditions and we will discuss those. Then there will be 2 other topics. One is erectile dysfunction or impotence in the male.
Sure.
And fourth would be infertility. That means inability to conceive a child. What are the male factors or male infertility? Because infertility can be female as well as male. So we will only restrict because the urology part is in the concerned with the male. So let us start with the topic of inability to pass urine.
Sure.
The medical term for this is known as retention of urine, where when you see the patient, he comes, generally he'll have a lot of discomfort because you can imagine if the urine is full and you are not able to pass urine, what can happen, right? So he will have a distension here in the lower part of the abdomen below the umbilicus. If you press on that, you will get very severe urge to pass urine and it may cause little pain also. If you do an ultrasound, you will find that the urine is full, the bag is full of urine and he is not able to pass urine. So this is the definition of retention of urine or inability to pass urine. Now what are the causes for this? The most frequent and common cause is enlargement of the prostate. The prostate is a walnut shaped gland which is at the base of the bladder and the urine tube. That means the urine tube, then the prostate and then the bladder. Okay? This gland in males, it starts enlarging after the age of 50-55, and when it enlarges, it can cause blockage of the urine. How? We'll come to it in detail. This is the first condition. So if there is retention of urine in an older person, and the more older he is, the more the chances are it is due to prostate. That is one. Second cause, generally in younger patients, is stricture urethra, which means the urethra is the tube that comes from the prostate and comes into the penis and out. Okay? If there is any narrowing anywhere inside this tube, then patient can have retention of urine or inability to pass urine because the narrowing over there, right up to the tip of the penis, which is called specific name called meatal stenosis. That means meatus means it is the opening of the urine passage. If that is narrow also it can happen. Okay. So if the person is younger and has got bladder retention, urine retention, you may think that it is a retention due to stricture. The third cause is a stone in the urine, in the bladder, which has blocked the passage of this stone. So generally that can happen to anybody. So the stone, what happens is it comes from the kidney, and then when it comes down into the bladder, it remains there for some time, and then it becomes slightly bigger, and then it goes and blocks the passage of the urethra, from where the urine has to come out. So sometimes, not very common, but you do see a stone which is causing retention of urine. So these are the three conditions of retention of urine.
Sure.
So let's start with prostate. The prostate is the commonest urological complaint of a male, okay? Because it is age related. It has nothing to do with what you do, what you eat, what is your occupation, nothing. It is age related. The longer you live, the chances are that you will have this symptom at some stage in your life. Okay? So let us discuss why this happens. So this is basically the changes of aging in a male. So as you know that just like the ladies have estrogen and progesterone as the two female sex hormones which give all the characteristics to a female, similarly you have the testosterone, which is the male sex hormone, which gives the characteristics to the male, such as growing a beard, the muscle, this, everything. Now with aging, the level of testosterone starts falling, and what happens is that these hormones are interrelated. That means they all arise from cholesterol. They are steroids, right? They arise from cholesterol. And from cholesterol you get progesterone and estrogen, and then it's converted into testosterone. That means testosterone is derived from something like estrogen, right? So what happens is when the level of testosterone starts falling, or there is a problem with aging where the steroid, the estrogen like substance which gets converted into testosterone does not happen, then there is an accumulation of estrogen like substance and lack of testosterone, right? As a result of that, the gland starts enlarging. So this is one theory, which is hormonal theory, which suggests that certain changes in the hormonal makeup of the male, like there are hormonal changes in females around menopause, right? When the periods stop, at that time there are certain changes in the body. Those people who have menopause, after a few years, their bones tend to get weaker, they get osteoporosis. So like that, some changes happen in the males related to the hormones, where the testosterone levels go down, or the conversion of the pre-testosterone hormones is not getting fully converted into testosterone, or for whatever reason testosterone levels go down, that leads to enlargement of the prostate. The second theory is that it is a tumor. Like any other tumor, the prostate becomes into a tumor, and then the prostate just enlarges because it is a tumor. Like you have a tumor here or a gland or something like that. Okay, but that has not got that much of credence as much as the hormone, because if it is a tumor, why should it happen in everybody? Because the prostate enlargement happens almost in every male. Whether he gets symptoms of that or not, there's a different issue, but the enlargement will be there. If you see ultrasound of, let us say, a 60, 65, 70-year-old man, you will find that the prostate will enlarge to some degree. Not necessarily, the degree would be different in different people, but it would be enlarged. And if you do a histological examination, you will find certain changes inside the prostate which are known as benign prostatic hyperplasia, BPH. So what is it? What happens is that the prostate is a fibromuscular adenomatous gland. That means it has fibrous tissue. You know what is fibrous tissue?
Yeah.
Right? Like you have tendons and all fibrous tissue.
Correct.
It has muscle, smooth muscle, and it has glands.
Okay.
Just like I told you, compound racemose gland, where there is like a bunch of grapes, all glands, and then all of them come into one and secrete, like in the breast.
Correct.
Similarly, there are glands in the prostate. Now these glands are active when the person is younger, because they have a role to play in prostatic secretion, right? Which is meant for at the time of intercourse to improve the transport of the sperms and to keep the sperms viable. Okay, and there is something called the seminal vesicle, which produce semen, which is the fluid which nurtures the sperms. Okay, so the sperms come from the testes from down, and the seminal vesicles arise from behind the prostate. So the semen, and they all get mixed up, and then they come out through one duct which is known as the ejaculatory duct, which opens just ahead of the prostate. Where the prostate is just below that is the ejaculatory duct. So when you are having intercourse, what happens is that the sperms come from the testes to the vas into the ejaculatory duct, and from the seminal vesicles the semen comes, it mixes up and comes out as semen. In that, the prostatic secretions are also mixed. So all these three things get mixed up and then it comes out, right? So as the person ages, these glands become hypertrophied, the smooth muscles become hypertrophied, and the fibrous part also becomes hypertrophied. So that's how it starts enlarging. Now the prostate has got three zones: an outer zone, a middle zone, and an internal zone. The internal zone is just around the passage of the urethra. That means if you take, suppose, an orange, after you peel an orange, you will find an orange with a hole inside. Imagine it the same way. Prostate is like this, and the hole is the urethra. Now the inner portion of the orange, if it is known as a transitional zone. That is the one which enlarges. The outer portion next to the inner portion, the outer portion or the middle portion, is the central zone, and then there is a peripheral zone. So you have a peripheral zone, a central zone, and a transition zone. The transition zone is the one which enlarges, and as it enlarges, it pushes the peripheral zone outwards into kind of a very thin structure, like the covering of the orange. If you feel that the orange is enlarging and it is pushing against this, and it is converted into a additional skin of the orange. That is known as the capsule. It becomes a capsule, and the central zone tends to grow up towards the bladder, inside the bladder. So if you imagine a sphere, it can grow upwards, it can grow outwards, and it can grow inwards in all three directions. Now, which way it will grow first will depend on when the symptoms of the prostate come. So some people can go through their life without symptoms, but they have a large prostate because the growth is more towards the outside. That means it's growing more outside. So it is not causing symptoms. Though the prostate is big, it's not causing symptoms. But if we were to grow inwards, then it will compress the urethral passage. And because it increases in size, it lengthens the urethra also. So it lengthens and compresses to a certain extent. And if it grows inwards, also it is going towards the bladder neck where the opening is, and it is compressing there. This central growth and the transitional phase, transition zone which grows inwards, causes the blockage. Okay. Now what are the symptoms? The symptoms are divided into two types, and they are called as lower urinary tract symptoms, LUTS. It's a combination of symptoms. Now there are symptoms related to voiding, that means passing the urine, and related to the frequency, that means irritation. Now what are the irritable symptoms? Irritable or voiding and irritation. Now the voiding symptoms are, there will be hesitancy, that means patient goes to pass urine, he has to wait for about half a minute to 1 minute before he passes urine. He cannot immediately pass urine. Even if the urine is full, he cannot pass urine immediately. He will take some time to pass urine. Second symptom is, the stream will not go far, it will fall near the leg. Third symptom is, after he passes urine, there will be dribbling of urine, little bit. Okay? So these are the symptoms of voiding, where there is a blockage. So the urine passage is not smooth. The passage of the urine is not smooth. Alright. Irritative symptoms are frequency. He keeps like, he feels like going to pass urine again and again. Again and again. Second is, he has to get up at night to pass urine, called nocturia. Okay. And the third is urge incontinence. Means what? It's so urgent that if he doesn't go to a bathroom, immediately he'll pass the urine. So these are irritative symptoms. One are voiding symptoms, blockage symptoms, these are irritative. Why do these happen? When the prostate grows inside and abuts against the internal sphincter, there is an internal sphincter of controlling mechanism of the bladder. When it does that, it causes the sensitive area of the bladder, which is the trigone, which is at the base. Bladder is like this. The central area is the trigone, very sensitive. Now the gland is pressing against that. So even when little urine comes, it gives the sensation as if you want to pass urine again and again. To the extent that how much this growth is going inside the bladder, it will create the irritative symptoms. So this urge incontinence because of constant stimulation of the trigone by the tumor pushing against the trigone from underneath. And the voiding symptoms are because of the compression of and the lengthening of the urethra. Okay. Sometimes they even can get bleeding blood in the urine, which is very rare, but because when the prostate is pushing up, all the blood vessels become like your varicose veins, they become dilated. Sometimes they rupture and then blood comes into the urine. Okay. Now, what are the side effects of this if you don't do anything? Over a period of time, the bladder will want to push harder and harder, and the bladder will become very muscular and it will become trabeculated, So the muscles become enlarged and becomes thickened. And sometimes what happens that from the kidneys, urine is coming into the bladder and then going out. Now when the bladder wall becomes thickened, and because some urine is remaining behind, because all the urine is unable to pass at one time, which is called residual urine, the pressure in the bladder is not normal. It becomes elevated all the time. This elevated pressure then gets transmitted to the kidneys and the kidneys start enlarging. Finally, the person can go into kidney failure if he doesn't get his prostate treated. Okay. So the first is the pressure. The pressure increases inside the bladder and the bladder wall gets thickened, causing back pressure changes on the kidneys. Second, because the urine cannot come out fully at one time, some patients get repeated infection, because whenever urine remains inside, it can attract the germs to start growing in that, right? So repeatedly urine infection. Third, because the urine remains behind, stones can form. So the patients with prostate enlargement can get secondary stone formation. So if the patient gets urinary tract infection again and again, if he has got a bladder stone, or if you find significant residual urine and back pressure changes, in addition to the first symptom, inability to pass urine at all. So it's the final stage, inability to pass urine is when they go into retention. But before that, what will happen is all these other symptoms will be there. That, narrow stream, wanting to, getting the feeling wants to pass urine again, etc. When you do an ultrasound exam, you will be able to measure the size of the prostate. You will also be able to measure the amount of urine remaining behind. So you go on a full bladder, pass urine, go back and immediately after that measure the urine. If it is more than 200 to 250 ml, it means that you are passing only half your urine, the rest of the urine is remaining behind. That will also need surgery. So the indications for surgery in patients who are inability to pass urine due to prostate is first, inability to pass urine, that is retention. Second, significant residual urine. Third is recurrent urinary tract infection. The fourth is bladder stone formation. And fifth is back pressure changes in the kidney with raised urea creatinine. Now what are the investigations? The best investigation to do is to do an ultrasound. And there are two types of ultrasound you can do. One is from above, the regular one, and the other one is a transrectal ultrasound. That means one of the tests we do when the patient comes is we put our finger, called digital rectal examination, DRE, and we feel the prostate, how big it is, what is the feel of the prostate, whether it is hard, soft, firm, whether any nodules are there, right? Three things we see: size, nodules, and the consistency. So we do a DRE. The third test we do is an ultrasound exam, where we do the ultrasound from above, and you can also do transrectal. Now transrectal ultrasound, the probe is just like a finger and it is very near to the prostate, so you get a magnified view of the prostate. But that is usually done if you are suspecting malignancy. If you feel a nodule on your rectal examination, you want to do and find out what kind of nodule is it. Is it a benign or a malignant nodule? So a benign nodule will be, it is ulta in prostate, a darker area Now darker area normally is fluid in ultrasound. So when you get a darker area or sonolucent, what is called, not sono-active but sonolucent area, then that could be malignancy. So you do what is known as transrectal ultrasound with a guided needle biopsy. Okay, under ultrasound guidance you can put a needle and take a piece and see whether it's cancer prostate. So the first test is to do urine test to find out is there any blood or infection. Second is urea creatinine to find out back pressure changes. Third, the ultrasound to measure the size of the prostate, residual urine. Fourth is transrectal ultrasound, and fifth is we do PSA, that is prostate specific antigen, which is a test for finding out whether there is a raised. If it is raised, it could signify cancer. So suppose you do a digital rectal examination and you find a nodule and a raised PSA, that would be an indication to do transrectal ultrasound and needle biopsy. Okay, so this is the evaluation of the prostate, right? Once you evaluate the prostate, you have to treat it.
Correct.
So basically there are many ways of treating the prostate. Basic thing is to remove the enlarged prostate. So when you say we are going to remove the prostate, we are not removing the prostate. What we are doing is we are only removing the enlarged part of the prostate and re-establishing the passage, so patient can pass urine freely. Now this can be done. The commonest procedure is called TURP, which is transurethral, that means through the urine passage, resection, that means removal of prostate. But it's not prostate, it is transurethral resection of the enlarged portion of the prostate. Now this can be done with the help of an electric current through a rigid telescope which is passed through the passage, or you can use laser instead of electric current. Okay, so you can use either of these. Now it is very large, you can do an open surgery, because open surgery is safer. When you have to do TURP, you should not do it for very large glands, because when you are doing it, you are allowing fluid to go through, water or glycine, and it can lead to other complications called TUR syndrome. We will not go into that. But when you feel that the amount of time required for resection is more than 1 hour, it is better to do open prostate from above, which is the old technique, which is also good, but it is restricted now to very large prostate. If the prostate gland normally is 15 grams, most prostates which come to us will be in the range of 40 to 70 grams. But if the prostate is beyond 100, 150 grams, then removing that much of prostate from below becomes very tedious and it can have other complications. In such cases, it is better to do open old technique. Okay. Then just for sake of completion, there is a procedure called HOLEP, which is holmium laser enucleation of prostate. What we do, we remove the prostate from above through an open operation. The same can be done with a special laser procedure from below. But it needs a lot of equipment, specialized training, and is expensive. But it is available to do that.
Sure.
Okay. Now, before the patient goes into retention, if he comes with an enlarged prostate, it's very common this. He has only got LUTS, LUTS. He has got some symptoms, and he has come to you and you see that's an enlarged prostate. But neither he has residual urine, nor he has urinary tract infection, nor he has a stone. What do you treat them with? Then there is a medical treatment for this. You use a combination of 2 drugs, which is one drug which is called a 5-alpha reductase blocker and an alpha blocker called tamsulosin. So you use tamsulosin and detruside. These drugs, what they do, they relax the sphincter, and that other drug, that is deuteroside, shrinks the prostate.
Okay.
So in early stages, you can use medicines. At a few years back, we had to operate every patient of prostate. Now a good number of people, we can try medical line of treatment, and after that, if they go in for, or they don't respond well, or they have these other symptoms where surgery is required, then we go for surgical treatment.
Sure.
The only thing is that this treatment has to be taken lifelong.
Oh,
The medical treatment has to be taken lifelong.
got it. Sure. All right. Sure.
Okay.
Thank you so much, doctor. So this was all about the condition where you are unable to pass urine
Because of enlarged prostate.
because of enlarged prostate. So if you have any queries, do let us know in the comment section. Like our video, share the video, and subscribe to our channel. And stay tuned for further conditions coming in soon. Thank you.